All new at 7, when a venomous snake bit a contestant on this season of Survivor, fans held their breath while the show's medical team jumped into action.
And one of the doctors who helped that contestant is also an emergency room doctor right here in North Carolina. Yeah, CBS 17's Maggie Newland spoke with her about her work on the show and at UNC Health Southeastern.
In this recent episode of Survivor,
I don't know. It was on the bottom of my foot.
A highly venomous black and white sea snake bites contestant Jake Latimer, sending the show's medical team rushing to help.
Is he breathing? Is he breathing? Polo, is he breathing?
One of these doctors is Sarah Spelsberg. She knew right away a bite from this type of snake, a sea crate, could be deadly.
Anytime I'm going somewhere on expedition, whether it's to Aconcagua in South America, to the mountains, I kind of Google or whatever research, what can kill you there? And the first thing that came up when I Googled what can kill someone in Fiji was the sea crate.
Dr. Spelsberg is the director of U.S. operations for World Extreme Medicine. She's worked across the globe in various roles, as a search and rescue paramedic, a physician's assistant, and now a doctor.
I also spent a good chunk of my career out in the Aleutian Islands where they filmed Deadliest Catch. And that, out there, you have to ride with the patient in the back of a Coast Guard C-130.
But she doesn't always work in remote areas. She's also an emergency medicine resident at UNC Health Southeastern in Lumberton. She says there are more similarities than you might think.
I've seen as many snake bites in here at UNC Health Southeastern with copperheads and coral snakes as I have anywhere.
In the wilderness or the ER, the goal is the same.
It's the same thing when you get somebody who's had a terrible surfing accident or they fell and you're afraid they broke their neck out in the middle of nowhere. They've had a crush injury on a Deadliest Catch fleet boat. Whatever it is, it's adrenaline, but it's also a rush of optimism. It's like we have a chance to help somebody, like something terrible happened, and maybe we can fix it or at least make it a little bit better.
So when the medical team on Survivor learned of the snake bite, they were ready to respond.
You saw me put a SAM splint on the leg and a dressing, and then we carried him just because you don't want them to be too active. Because what if he did get a little bit of venom and then suddenly you're spreading it through his lymph system all over his body?
Fortunately, in this case, the snake did not inject venom. But Dr. Spelsberg says they are prepared for any emergency.
I would pit us against any team I've ever been on, honestly. We can run a code. We can turn ourselves into an ICU. We can intubate you. We can shock you. We can give you medicines. We can do everything we do in the trauma resus bay, everything we do in the ICU on a beach. And we did.
That episode with the snake bite was season 49, episode 3. Survivor airs every Wednesday right here on CBS 17. Tune in tonight at 8. I'm Maggie Newland. Back to you.
Okay, what a cool job she has, number one.
Fascinating. I love that she is here in our area, too.
I had no idea that, I guess I assume they have medical teams on site for things like that, but for them
they need them, clearly,
and they quickly jumped into action to just incredible work there.
I just love the fact that she knew what to do immediately.
Me too.